So welcome again all of you. This is the day 4 of our anatomy mega MCQ series for 8 weeks. This is day 4 and today we'll be discussing about the lower limb MCQs, right? MCQs and the questions and the topics related to the lower limb. So without wasting any further time, let's start the session over here. While on a neurology rotation, the attending physician asks you to test a patient's femoral nerve function. Which of the following would you do? So a femoral nerve, we have just studied कि femoral nerve is supplying the anterior thigh muscle. ठीक है ना? Anterior thigh. Anterior thigh, the muscles mainly involved over here are, let me tell you, these are the quadriceps femoris. Quadriceps. इसमें 4 muscles आती हैं. 3 are vastae, and 1 is your rectus femoris. Main muscles ये हैं. Then it also includes sartorius and all. So ये सारी muscles हैं. So vastae lateralis, vastae medialis, vastae intermedius, and 4th is rectus femoris. They form the quadriceps femoris. What all these 4 muscles do? They go and attach to the patella. From patella, they go to upper end of tibia, tibial condyle. So they are running in front of the knee joint. क्या करते हैं ये पैर को सीधा करने में? To straighten your knee. They help in extending the knee joint. Up, if you are sitting and you just extend your knee joint, you straighten your leg, you will feel a tightness in the anterior thigh. वही quadriceps femoris है. And all these are supplied by which nerve? By this femoral nerve. ये point है. So if someone is asking you भाई इस patient की femoral nerve test करो, test the femoral nerve of this particular patient, what will you ask the patient to do? वो option है, देखते हैं. Have the patient flex his knee, तो उल्टा हो गया. Flexion his knee उल्टा हो गया. Here you are testing which muscles? Hamstrings. ये क्या होती हैं? Posterior thigh में. Have the patient rotate his thigh medially while you resist rotation. This is the medial rotation of the thigh. इसके लिए अलग muscles हैं like anterior fibers of gluteus medius minimus, वो help करेगा. Have the patient extend his thigh against your resistance. अब ये लग रहा है सही आंसर है. But here extension is of the thigh, not of the leg. Extension of thigh कहाँ पे होगा? This will happen at which joint? This will happen at the hip joint. And what is extension of thigh? Extension of thigh is moving your lower limb behind posterior. Let me try to show you over here. कि जैसे मान लो this is a person, the buttock region and the lower limb, ये आपका anterior part हो गया, ये घुटना आ गया, this is the knee, this is anterior, that is posterior. Moving the thigh and the femur posteriorly, इसको this is known as extension of the thigh. Who causes this? This is caused by gluteus maximus. And moving your thigh or the femur anteriorly, that is known as flexion of the thigh or flexion of the femur. Which muscle causes this? It is done by iliacus and psoas major. याद रखिए. So third option over here, as they are saying कि भाई ask the patient to extend the thigh. यहाँ पर here you will be testing the muscle gluteus maximus. Fourth option is our best answer. Extend the knee against resistance. This is the role of anterior thigh muscles supplied by the femoral nerve. Right here, let me show in this cadaveric image the femoral nerve. यहाँ पे देख लो कुछ चीजें जल्दी से. Have a look at all these branches of the femoral nerve. ध्यान से देखो. This is the upper part of the thigh around the inguinal region. Here you also witnessing femoral vein and artery. This is the lateral aspect. ये है हमारा. This is the medial aspect. And muscles over here are few muscles are shown like sartorius muscle. Over here is shown rectus femoris is shown and others. Focus on the femoral nerve and how it is gramifying, dividing into so many branches, which is going to supply all the anterior thigh muscles, which I already told you few names. याद रखिए. And these are all the anterior thigh muscles. And this is where was the location of femoral nerve. ये अलग image है, but let me show you. This is where the femoral nerve was shown in the previous image. ये रहा. How to localize? ये देख रहे हैं यहाँ पे sartorius. ये looking sartorius. Here also this is the sartorius over here. यहाँ पर ये हमारी sartorius muscle है. And you can see the femoral nerve ramifying and just dividing all these. सब innervate कर लेता है. This all is innervate. Now this question asks that a physician performs some simple muscle tests on a 35-year-old male patient when he complains of weakness in his lower limb. In the physical test listed below, the patient is asked to touch his buttocks with his heel. So here we can see the position of the buttocks over here, and this is the heel over here. So he is asked to touch the buttocks with the heel over here, right, against resistance. Okay, so there's a resistance being given in this direction. You can see from the hand, this is the direction in which the resistance is actually being provided. What muscle group is being tested? Simple question now. The patient is asked to move the lower limb in this direction. Okay, resistance given in this direction. So what muscle group is being tested? So what is the action which is being asked by the patient to do? The patient is asked to flex the knee. Patient is asked to flex the knee against resistance. The movement over here, this movement, this is the angle around the knee, this movement is the flexion of the knee. So flexion of the knee is done by which group of muscles? If you flex your knee, you will feel the muscles in the posterior thigh, they are contracted. जो thigh के पीछे muscles होती हैं, they are contracted when we flex our knee. हम knee flex करते हैं. And those group of muscles are known as hamstrings. Hamstrings. And what are the various muscles which come into this hamstrings group? Basically semis हैं. One is semimembranosus. Then we have semitendinosus. And we also have two heads of biceps femoris. याद रखिए biceps is not only of upper limb, सिर्फ ऊपर upper limb की नहीं है, biceps is also for the lower limb, biceps femoris, short and long head. And these are mainly supplied by the tibial nerve. Tibial nerve mainly supplies these muscles. So if you look at the options, I hope the answer is pretty much clear now. Option क्या बनेगा? Quadriceps, hamstrings. Hamstrings is the answer over here. Option B. और options देख लो. Quadriceps femoris is present in the anterior thigh. क्या मूवमेंट कराएगा? इट विल कॉज एक्सटेंशन ऑफ नी. एक्सटेंशन ऑफ नी. एडक्टस इज इन द मीडियल थाई. क्या कराएगा? एडक्ट. ट्राइसेप्स सूरी आर योर गैस्ट्रोनीमियस, सोलियस एंड प्लांटेरिस. वो नीचे जाएंगी इनटू द एंकल जॉइंट. लेट्स सी एन इमेज ओवर हियर आल्सो. दिस इमेज इज शोइंग अस लेटरल व्यू है. दिस आर ऑल द हैमस्ट्रिंग्स. These are all the hamstrings, and when they contract, the lower limb will actually move in this direction. जो पैर हमारा leg है, that will move. That is a flexion. Okay, fair enough. Let's see the next one over here. A soccer player injures his left knee when he twists the flexed knee while trying to avoid and the player. अच्छा जी, injury हो गई. While performing a knee examination, a physician pulls the flexed knee towards her body as shown in the illustration. Physician is trying to pull the knee towards the physician's body. The clinical test is a check for the integrity of which of the following ligaments. Now what is actually happening is, this is the thigh part, ठीक है? That is the leg part. Now the physician over here is trying to pull the leg towards the physician's body. Why so? Because there is a couple of ligaments inside the knee which are crossing each other. एक ऐसा जा रहा है blue color का, and then one is going in this direction, say the red color. The bone that is present below in the leg is mainly tibia. Knee पे वही बनाती है, tibia in the leg and femur in the thigh. This blue color ligament which is attached to the anterior part of tibia is known as anterior cruciate ligament, ACL. This red color ligament is known as PCL, posterior cruciate. Why? Because they are attached anteriorly and posteriorly on the tibia. Now if these ligaments are broke, टूट गए, damaged, because see, if you look at the history, we will realize twisting of the flexed knee. In this mode of injury, normally the cruciate ligaments are injured. So if these ligaments are injured, then there will be abnormal movement. कहाँ पर? There will be abnormal movement in this leg region. Now, here the physician is pulling the leg towards the physician's body. Which ligament is the physician testing? Or if I may ask otherwise, अगर मैं दूसरी तरह से पूछूं, that if you pull the leg towards your body, it is checking the integrity of which ligament. मतलब अगर कोई ligament normal है, ठीक है, तो ये abnormal movement नहीं होगा. You are pulling the leg towards you, वो abnormal movement नहीं होगा. किस ligament की वजह से? Blue और red, इतना बताओ बस. अगर blue ligament, if the blue ligament is torn, will there be abnormal movement anteriorly? सोच के देखो. Blue ligament, what is the normal function of blue ligament? Blue is the ACL. The blue ligament over here is preventing the leg from going forward. ये leg को, leg means below the knee, उसको रोक रहा है आगे जाने से. Therefore, if ACL is normal, then ये abnormal movement नहीं होगी. If ACL is broken, अगर ACL टूट गया है, only then there will be abnormal anterior movement. So this anterior pushing or not pushing but pulling of the leg is आफ्टर टेस्टिंग द ACL इंटीग्रिटी, ACL सही है कि नहीं है. तो सर PCL कैसे करेंगे? PCL, फॉर PCL टेस्टिंग यू हैव टू पुश द लोअर लिम्ब पोस्टीरियरली or push the leg posteriorly. This is to check the integrity of posterior cruciate ligament. Now, if there is abnormal anterior movement, it means ACL is ruptured, ACL damage हो गया है. So see, let me show you in other ways भी देख लेते हैं. This suppose is the lateral view, ये femur है, this is the tibia, lateral view है, anterior posterior. Again blue color tibia में आ गए, this is ACL, this is anterior cruciate ligament. Normally, if I try to pull the leg forward, ACL रोक रहा है. ACL is preventing the leg from going forward. Now, if this ACL is damaged, है ना, if the integrity damage हो जाती है, then what will happen? Then if I may try to draw it, मैं सीधे बना ही देता हूँ. Let me remove this part and let me draw the bone and then let me draw this ACL. ACL ऐसे, but ACL टूट गया है. Now what we can do is we can easily pull the leg forward. Anterior draw test इसको बोलते हैं. The clinical test is a check for the integrity for which of the following. I hope the topic is clear now. It is to check the anterior cruciate. अगर उल्टा हो रहा है then it is posterior cruciate. Okay. And here's the image to show you the knee ligaments. Cruciate ligaments are thick and very strong. And inside the cruciate ligament, the PCL is thicker or stronger than ACL. If someone asks which ligament is easily broken, it is ACL. Even there is an unhappy triad. There are 3 ligaments in the knee which can be easily broken. One of them is ACL anterior cruciate, दूसरा triad, 3 होंगे. Second is a meniscus, medial meniscus over here. And third is a tibial collateral ligament, also known as a medial collateral ligament. Tibial collateral ligament. तीनों को यहाँ पर we will try to find out. This is medial meniscus. इसी से लगा हुआ है tibial collateral. And finally you have this as the anterior cruciate ligament. ये हमारा हो गया anterior cruciate ligament, right? So collateral ligaments are on the sides, cruciate एकदम बीच में होता है. Fair enough. Let's see the next one over here. After straightening the woman's knee, the patellar dislocation is reduced. Patella dislocate कर गया and they have straightened the knee. To prevent future dislocation of the patella, what specific muscle should be targeted during rehabilitation? So it's a case of patellar dislocation which has been reduced. वापस इसको normal कर दिया. Now to prevent the future patellar dislocation, which muscle group are they asking? किसको आप और hypertrophy करोगे, किसको आप exercise करोगे? To understand this, we must understand that this is the right sided अगर femur head है, this is right side femur neck, that is greater trochanter, small lesser trochanter. This is how the shaft of femur comes down and this is how the 2 condyles of femur behave अगर right side femur बात करूँ. This blue color bone over here will be the patella. ये patella is sitting over a lower end of femur, right? Just a second. Okay, yeah. So this is the bone, that is the patella. Now all the muscles, now ध्यान से देखो, look carefully. All the muscles over here are actually coming and joining the patella, the quadriceps muscle. If I show you in patella in isolation, this is say the patella, है ना? Now look at the muscles attached to it. This is say the lateral side of patella, that is say the medial patella. We are looking at a right-sided patella. The muscles over here are, this is a muscle on the lateral side, that is a muscle on the medial side. Attachment है muscles का on the patella. Which muscles? Quadriceps femoris. And then on the top there are 2 muscles over here which are attached. Now this can be a good question also if I mark them A, B, C and D. What is A, B, C and D? Which muscles are A, B, C and D? ये भी question बन सकता है. It can be a good question. Now C and D we can easily recognize कि यार C तो lateral में है, so vastus lateralis, D medial में, vastus medialis. What is A and B? A and B would be rectus femoris and vastus intermedius, but which is rectus femoris, which is vastus intermedius? ये confusion है. B over here is the rectus femoris which overlaps the A muscle, vastus intermedius. Now see what happens is, as these muscles are attached onto the patella first, right? मान लो ये सारी muscles आके से attach हो रही हैं. If you look at the direction of the vector of the muscles, कि pull किस direction में जाएगा? Pull is not exactly straight upward. ऐसा नहीं है. Pull is not in this direction. Then in which direction is the pull? पुल थोड़ा सा बाहर की तरफ जा रहा है, दिस डायरेक्शन ऑफ द पुल ऑफ द मसल्स ऑन द पटेला. Therefore, patella is prone to dislocate laterally. It is prone to dislocate laterally. याद रखिए. It is prone to dislocate where? Laterally. बाहर की तरफ it is prone to dislocate. अब इसको avoid करना है. Then what is to be done is the muscle which is attached onto the medial aspect. यहाँ this muscle attachment has to be huge. And if you look carefully in the diagram also which I tried to make over here, this is the vastus medialis attachment. It has the largest attachment onto the patella if you compare it with the vastus lateralis. So if they ask you what specific muscle should be targeted during rehabilitation, medialis, usko और strong करो. Make this vastus medialis more stronger so that it prevents the patella from going laterally. इसको यहाँ जाने से रोके. That is the whole point. Okay, here you can see the muscles. I hope it's clear. Remember also कि when the muscles are attached onto the patella, then they form a tendon over here. क्या बोलते हैं इसको? Patellar ligament, where we test that knee jerk reflex, patellar tendon reflex, and this attaches onto the tibial condyle. याद रखिए इस बात को. Okay, fair enough. Let's see the next one. A 45-year-old male is treated at the hospital after he fell from his bicycle. Examination reveals fracture of both tibia and fibula. Oh, so there is fracture of both tibia and fibula of a 45-year-old male. On examination, the patient has a foot drop but a normal eversion. Very important, like wrist drop in upper limb, we have foot drop in lower limb. Which nerve is most likely injured? Foot drop हो गया, eversion normal है. Fracture of both tibia and fibula. Few things to understand over here are as follows. The leg region has 3 compartments. The leg region has 3 compartments. ध्यान से सुनो. एक नहीं, दो नहीं, पूरे 3. There is an anterior compartment, there is a lateral compartment, and there is a posterior compartment. The muscles of the anterior compartment, they actually dorsiflex, or you can say they extend the ankle. The muscles of the lateral compartment, they evert, they cause eversion movement at the ankle region or the foot region कह सकते हो. The muscles of the posterior compartment, they plantar flex, or simply we can say they cause flexion at the ankle. The nerve supply of these 3 are as follows. Anterior compartment by the deep peroneal nerve, lateral compartment by the superficial peroneal nerve, and posterior compartment by the tibial nerve. अब खुद देखो, foot is like this. Foot drop कब होगा? When which group of muscles are paralyzed? When you cannot dorsiflex the ankle or the foot, foot will go into drop. Normal foot is like this. You dorsiflex like this, and this is plantar flexion. ये dorsiflexion है, plantar flexion है. अगर dorsiflexion नहीं कर पा रहा है foot, then foot will go to foot drop. Which muscle group is causing dorsiflexion? Anterior, deep peroneal nerve. And also do remember over here that both of these peroneal, they are branches of common peroneal nerve. Common peroneal nerve, याद रखो. Now it is saying that patient has foot drop, मतलब deep peroneal nerve तो injured है, but normal eversion. ये सही है. Superficial peroneal nerve is okay, and this deep peroneal nerve is not okay. Question में आ रहा है. Which nerve is involved? We know the answer. Answer हो गया हमारा simple deep peroneal nerve. But if they change the question, patient has a foot drop and decreased eversion or loss of eversion, decreased या फिर loss of eversion. Pick one answer. In that case, deep peroneal भी गई, superficial peroneal भी गई. Answer क्या करोगे उस केस में? उस केस में we'll answer option number B. So option number B is involved when there is foot drop plus loss of eversion of foot. याद रखो. Option D में only foot drop. Option C क्या करेगा? Only loss of eversion. But remember, eversion is this movement when you face the sole of foot laterally. When sole of foot is faced laterally, कम use होता है. In a patient of superficial peroneal nerve injury, main problem क्या आएगी? Main is the sensory loss. Why? क्योंकि इसका यार नाम है superficial peroneal nerve. The name is superficial nerve. So it is close to the skin. Sensory loss कहाँ होगा? Dorsum of foot में. मोजा पहन रहे हैं, जूता पहन रहे हैं, चप्पल पहन रहे हैं, you are wearing the footwears, you are not हैविंग अ गुड सेंसेशन, सेंसरी लॉस हो रहा है वहाँ पर, इवर्जन भी फील हो सकता है, बट दैट इज टू बी टेस्टेड, but the sensory loss is more prominent. Let me show you a couple of images over here. These are all the anterior group muscles. These are all what? Anterior group. इसमें क्या क्या आती हैं? Tibialis anterior, extensor digitorum longus, extensor hallucis longus, right? And कौन सी, बस इतनी काफ़ी हैं. And these are supplied by what? Let me do one thing. This color over here is denoting what? This color is denoting the anterior leg की muscle. चलो जी और देखते हैं. Peroneus long, brevis peroneus longus. So this color is denoting what? The lateral leg muscles. Okay. और भी कुछ है, देखते हैं. We have gastrocnemius, we have soleus, right? ये दो ही दिख रही हैं अभी. And these are representing what? These are representing few of the posterior leg muscles. Posterior leg muscles are bulkiest because they are anti-gravity muscles. एक और इमेज देखो, just to show you how the common peroneal nerve as it winds around the neck of fibula, and this is the most common nerve to be damaged, as we have discussed earlier also. हमने पहले भी डिस्कस किया है. I would urge all of you, पहले के सेशंस जाओ, जल्दी जल्दी देखो, क्वेश्चन आंसर क्वेश्चन आंसर क्वेश्चन आंसर. Don't waste too much of time. I am giving over here all the relevant point of discussion. तुम्हें इतना टाइम नहीं लगाना है. Just have to go through the question, answer देखो question. If you know the answer of the question, if you are good with the concept, forward करो उसको. Come to the next one. Wherever in whichever question you feel कि यार हाँ इसमें थोड़ा समझ में नहीं आ रहा है, उसका डिस्कशन सुन लो. Listen to that discussion only, that's it. Don't give your whole time to 20-25 minutes, whatever the length of the video is. And remember, in the description of the video also मैंने time code दिए हुए हैं. Whichever question, just you can directly jump to the question also. That will also save your time. It is also going to save your time. Description में time codes हैं, click करो, पहुँच जाओगे. So this is how the common peroneal nerve divides into deep peroneal and superficial peroneal nerve. ये कोई इमेज हो गई. ठीक है भाई, चलो एक क्वेश्चन और कर लेते हैं. दिस इज अ डायग्राम शोइंग अस अ फुट ड्रॉप. ये राइट साइड में फुट ड्रॉप हो गया. फुट ड्रॉप इज वेरी प्रॉब्लमेटिक. क्यों? चल नहीं पाता आदमी. पर्सन कांट वॉक इजिली. दे हैव टू डू अ हाई स्टेपेज गेट. पैर ऊपर उठाना पड़ता है. तो इसमें क्वेश्चंस नॉर्मली कम क्वेश्चन आए हैं. क्वेश्चंस हैव रिसेंटली कम आल्सो अबाउट हाई स्टेपेज गेट. ये भी क्वेश्चन आए. सो रिमेंबर दिस आल्सो. चलिए लेट्स डू वन मोर प्रैक्टिकल क्वेश्चन है. अपने पंजों पे खड़े हैं. विच मसल ग्रुप आर यू यूजिंग? इफ आई ट्रांसलेट इनटू हिंदी, अगर हिंदी में ट्रांसलेट करूं, अब जब इंसान अपने पंजों पे खड़ा होता है तो उसकी लोअर लिम्ब या लेग में कौन सी मसल्स एक्टिव होती हैं? ये क्वेश्चन है. एज पार्ट ऑफ द फिजिकल एग्जामिनेशन टू एवेल्युएट द लोअर लिम्ब फंक्शन, अ फिजिशियन आस्क्स द पेशेंट टू स्टैंड ऑन द टिप टोज. व्हाट नर्व इज द डॉक्टर टेस्टिंग? आप मुझे बता दो कौन सी मसल ग्रुप है, कौन सी मसल ग्रुप हो रही है, राइट? आप इतना बता दो एंड नर्व इज इटसेल्फ क्लियर. सो व्हेन यू स्टैंड ऑन योर टिप टोज, मूवमेंट किस जॉइंट पे हुई है? हमेशा क्लैरिटी रखो. किस जॉइंट मूवमेंट हो रही है? हिप में, नीज में, एंकल में. एंकल मूवमेंट हो रही है. तो मूवमेंट इज अकरिंग एट विच जॉइंट? मूवमेंट इज अकरिंग एट द एंकल जॉइंट. ओके. एंकल में क्या मूवमेंट हुई है? डॉर्सी फ्लेक्शन और प्लांटर फ्लेक्शन. आप खुद देखो, सामने इमेज है. एंकल में वी हैव दी प्लांटर फ्लेक्शन. सिंपल यू कैन कॉल इट एज फ्लेक्शन ऑल्सो, बट बोलते हैं प्लांटर फ्लेक्शन. प्लांटर फ्लेक्शन इज डन बाय विच ग्रुप ऑफ मसल्स? इवन मैं तो इफ आई विल say to this level, if such sort of question comes in the exam hall, you are sitting, आप एग्जाम हॉल में बैठो, वहीं खड़े होकर ये मूवमेंट करके देख लो. कई बार you get a hint, be street smart. कई बार 2-4 सवाल हो सकता है ऐसे हो जाए, कोई मूवमेंट क्वेश्चन आ गया, कुछ ऐसा आ गया, then if you can possibly do it. ठीक है. So during plantar flexion, you know the posterior leg muscles are the ones which are involved. What is the nerve supply of it? The largest leg compartment is posterior leg. Anti-gravity muscles, tibial nerve. So basically किसी को टोस पे पंजों पे खड़ा करना है, you are testing the tibial nerve of the patient. आंसर हो गया हमारा ऑप्शन नंबर ए, tibial nerve. बात खत्म. ठीक है, सिंपल स्ट्रेट फॉरवर्ड. एंड दीज आर ऑल द पोस्टीरियर लेग मसल्स. कुछ मसल्स भी देख लेते हैं, दो वी हैव केप्ट अ वीक फॉर द इमेजेस, बट देख लो यहाँ पे थोड़ा बहुत. दिस इज द गैस्ट्रोनीमियस, जीसी लिख रहा हूँ. इफ यू कट द गैस्ट्रोनीमियस डीप, यू सी द सोलियस. गैस्ट्रोनीमियस, सोलियस, दे आर सुपरफिशियल पार्ट ऑफ द पोस्टीरियर लेग. उनके डीप में ये मसल्स आएंगे. व्हाट आर दीज? These are basically सारी flexor digitorum longus, flexor hallucis longus, tibialis posterior, इस तरह से gastrocnemius soleus कवर करती हैं. The calf muscles which you actually feel, ये gastrocnemius soleus, these are gastrocnemius soleus. Though all of them are supplied by, ये अच्छी बात है, tibial nerve, right? So that's all for this particular session. Anything you want to comment about, any other things, any other changes you want me to make for future videos, do comment, because this was the first week. This is the first week, and possibly any changes for your better understanding we can do. Again, here is the schedule. You can look at the whole schedule for the 8 weeks, and don't forget to press the like button if you have enjoyed the video, and do share and subscribe also. Share with your friends. अच्छा रहेगा, so you have a healthy competition. That's all from my side. All the best, and see you soon with the flying colors. And again, congratulations to all the FMG aspirants who have actually cleared the exam. Okay, you might be seeing some videos of mine with our FMG students, right? And for you guys also who have cleared the exam, your next future goal should obviously be a NEET PG or INICET, and this series is actually based on that also. So it has come at a very good time. We have started at a very good time. Just yesterday the results were out, and we started the series 2-3 days back only. So I think it's a very good timing, right, for you as well. That's all. See you soon. Bye bye. All the best. Thank you.